In other news this hour, Gauteng's increasing COVID-19 numbers are causing concern. Let's take a look now at how the current wave compares to the previous two. CSIR's senior researcher, Ridwhaan Suliman, is joining us now via Skype. Dr. Suliman, good afternoon. Thank you very much for your time and your patience this afternoon. Welcome to the Midday View on eNCA. Yeah, we saw the Gauteng Premier, David Makhura, earlier raising concern. We've heard the scientists raising concern. From your CSI perspective, how are the numbers looking now? Are we in that third wave?
Good afternoon, Dan. So if you look specifically within the Gauteng province, the number of new cases continue on a sharp increase as we've been seeing for the last 3 weeks now. The 7-day average of new cases reported in Gauteng is up to almost 2,200 new cases per day on average over the last week, and that figure has increased by almost 40% compared to a week ago. In other words, new cases in Gauteng are rising quite sharply and doubling about every 2 weeks. If we compare our current case loading, or firstly to answer your question, then we certainly are in a third wave in Gauteng as the case loading has surpassed that 30% threshold compared to the previous wave's
Now,
peak.
there have been fears about that third wave that we're in now in Gauteng compared to the second wave in December, January, that this might be worse. What is the trend looking like? What is that graph looking like?
So at the moment, the case loading currently in the current third wave is just over 40% of the previous wave's peaks. Remember, in Gauteng, both the first wave and the second wave peaked at very similar levels. And I think if we look at the rate of change at the moment, currently cases are doubling every 2 weeks. At a similar case loading in the previous waves, it was slightly steeper, doubling every 11 to 12 days. So still rising sharply, but heading towards that steep increases that we had seen previously. The concern about a more severe third wave in Gauteng is valid, and valid for a couple of reasons. One, because we saw a less severe wave in Gauteng in the second wave in January, the consensus is that there's probably therefore more people that are susceptible to infection this time around. And then secondly, because we are seeing a sharper and earlier rise in Gauteng relative to other provinces. Remember, in the previous wave, there were more restrictions when Gauteng was seeing a rise, so lesser restrictions now during the sharp increase.
Hospitalizations, admissions, are you also looking at those numbers in terms of your work?
Yes, we certainly are. Nationally, the number of new admissions, not unexpectedly, continues to increase. New admissions up to 3,800 last week across the country. And then again being driven largely by new admissions in Gauteng, where the hospitalizations increased by 40% compared to the previous week. We're not quite at the levels where the hospitals are compared to the large burden or surge in the previous waves. In Gauteng, the demand is still less than half of what it saw at the peak of the second wave.
Now, as a CSIR, you're a national institute, of course. We've spoken a lot about Gauteng. Are there other numbers that you're looking at elsewhere in the province? We know the Free State. I spoke to the MEC for Health for the Free State a few weeks ago. Met you here on the Midday View. They were already worried about the pockets of outbreaks of surges in different districts of the Free State.
Correct. So 4 provinces currently are concerned, and they are officially in their third wave. So we spoke about Gauteng. The other 3 are Free State, Northern Cape, and Northwest. If we look at Free State firstly, the case loading actually has stabilized over the last week. The number of new cases currently is at a similar level compared to a week ago. So possibly some promising signs there of a decline. However, it's very early to say. That case loading in the Free State was up to 90% of the second wave's peak. So it has been increasing for at least 7 to 8 weeks now, possibly showing some signs of leveling off. In the Northern Cape too, there are promising signs where the case loading has actually decreased by 8% week on week. It is still a bit early there to say as well. It's not on a sustained decrease just yet, but again showing promising signs there. However, that being said, the case loading in Northern Cape had exceeded the previous wave's peak by almost 50%. So outbreak there was really large. In the northwest, there's also a continued increase, up 5% compared to a week ago, and the case loading in that province is over 50% of the previous wave's peak. So all of those four remain a concern. That being said, the remaining 5 other provinces also are showing an increase in infections. Noticeably in the Western Cape, cases have increased by 27% now compared to a week ago, and in Mpumalanga, a 15% increase in that province.
So the country is currently... Sorry. So you say that the country is currently on an upward trajectory in terms of caseloads of the infections?
Definitely. So if we zoom out and look nationally, then the number of new cases on average that we're reporting nationally is currently just over 4,340. And that figure has increased by 22% week on week. So we continue to see the sustained increase nationally, driven largely by Gauteng, as we spoke about, where Gauteng is accounting for 50% of the total cases. The cases nationally are currently doubling by about every 3 weeks, and the case loading is up to 23% of the previous or second wave's peak and up to 35% of the first wave's peak.
When could we reach very high numbers? I mean, if you look at what happened in wave 1, wave 2, now as this wave 3 in those 4 provinces you've mentioned, including Gauteng, is there, and we're beginning to see an increase, including in the Western Cape, as you said. When could we reach the peak of this new wave, you think?
So it's difficult to predict exact timings of the peak. I think we also need to bear in mind the variation and the dynamics of the spread between the different provinces. Right now, Gauteng is surging and driving the national numbers, nationally the numbers are expected to increase for the remainder of the month. I think in terms of the peak, it depends how the spread continues. We are expecting to see the spread continue in the inland provinces, and then noticeably the neighboring provinces of Gauteng, Northwest, Free State that we spoke about, with also Limpopo and Mpumalanga expected to increase. And then the spread will continue in the Western Cape. We're starting to see increases there. And then possibly only later towards middle or later this month in the Eastern Cape, and then later in KwaZulu-Natal. So difficult to predict the exact timing of the peak. I think it does vary a lot on the spread between the provinces.
Dr. Suliman, thank you very much for your time and insights and explanations of the numbers as we see, as we are being warned about the third wave, and knowing that Gauteng, Northern Cape, Northwest and the Free State are already in the third wave, but numbers are increasing elsewhere in the likes of the Western Cape, Mpumalanga and Limpopo. We'll keep track of that. Please do take care. That was Dr. Ridwhaan Suliman, Senior Researcher at CSIR.